Welcome, Marcus, to the Homebody Podcast.
Thanks for having me.
My absolute pleasure. I'm so excited for this chat because we were just talking just before. This is such an area that I think is maybe under talked about, but getting the kind of its time in the spotlight at the moment. We're starting to understand how our gut health, our hormones, and all of these things are connected to our mental health and anxiety. So I'm really interested as to your perspective as to how do imbalances in gut health and hormonal fluctuations contribute to the development or exacerbation of anxiety symptoms?
Yeah, so from a gut standpoint, we now know it's very well documented that about 90% of our serotonin is actually made in the gut by the microbiome, which is that relaxing, feel good brain chemical. And then about 50% of our dopamine, which is that reward pleasure chemical, is also made in the gut. Any imbalance in the microbiome, which is that, again, that good and bad bacteria, can cause a disruption in the production of that serotonin and dopamine, which can directly impact our moods, our concentration, our memory, our focus, pleasure, rewards. So we always want to make sure the gut's nice and strong from that standpoint. So yeah, there's a huge connection there. And then I know you're a big fan of the vagus nerve, but that also has a big connection from the brain down to the gut as well. So I'm sure we'll get into that, talk about it.
Yeah, absolutely. And so, just for people that don't potentially know, are dopamine and serotonin considered hormones or are they considered neurotransmitters? What's the line between those two things?
Yeah, neurotransmitters. So those are
Yeah.
going to be more of the brain chemicals. And then
Yeah.
hormones are going to be other chemicals that are similar, but they have a different action in terms of things like most common ones, estrogen, progesterone, testosterone, thyroid hormone. So a little different in structure, a little different in function. So yeah, we talk about serotonin, dopamine. That's gonna be more your brain chemicals.
Yeah. And do they interact at all with our hormones? Like, do serotonin and dopamine impact our estrogen levels in any way?
Yes, they do. There's a big connection there. So it's very well documented and known that if there is any kind of decrease in dopamine and serotonin, that can directly impact cortisol levels, which is our main stress hormone. Any imbalance there can then impact estrogen and progesterone, which are those main female hormones. Men have them as well, but females a lot higher content. And then it can impact testosterone levels as well. So that's more the male hormone, but that's also something that females need for reproductive health, hormone balancing, mood, sexual, like libido, things like that. So anytime we have a drop in that serotonin and dopamine, we can see a drop in those hormones as well.
Yeah, I should circle back and ask you what got you so interested in the gut and the hormone kind of aspect of health in the first place.
Yeah, so I feel like most people in this field were patients at one point. That's kind of my story. I was having a lot of gut issues, memory, concentration, skin issues, hard time with memory recall. And I went to conventional medicine and they're like, here's a 10-minute appointment. We don't know what's going on, but here's some medication. It's like, there's definitely more to that than this. They asked me about my diet, my stress, my sleep, my exercise, my toxin exposure, any of those things. That's when I really took it into my own hands to figure out what was going on with my health. That's where I shifted my entire practice, focused more on functional medicine, helping people with more of the root cause, figuring out what's actually driving their conditions to begin with. So it was my own health issues that kind of got me into this area. I really focused on gut at first, and then it went into hormones. And that's kind of where the bulk of our patients in our office are. It's going to be gut issues and hormone issues.
Yeah, I would say the bulk of most people on the planet have gut health issues and hormone issues. Was there like a certain point in your own experience? Because I feel like it's really easy to kind of normalize like lack of energy, brain fog, skin issues, these types of things. And we just kind of boil it down to like, oh, I'm stressed out type of thing. And that's definitely one aspect of it that's going to cause some chronic issues in our body and mind. But for you personally, was there a point in which you're like, this has gotten to a point where it's not manageable anymore? Like I can't keep going like this.
Yeah, I was out with dinner, or I was at dinner with a buddy one night, and I'm not a big drinker by any means, but we had like 2 beers and we ate out. And the next morning I woke up, I was so bloated. I was swollen, I was inflamed. I went to work next day and I walked in 10 minutes later. I'm like, what did I just talk to that patient about? I can't remember. I was like, all right, something's going on here. I got to figure this out. So that was kind of like my big like aha moment. Like you really got to get your stuff together here and figure out what's going on.
Yeah, absolutely. When it starts to impact your kind of like daily functioning to the point where you're like, I don't even know why. Like it happens to me now being postpartum where I'm like, I don't know why I walked into this room anymore. My memory's just gone. So I think that's definitely linked to hormonal changes, but it's super interesting because I feel like we all kind of have that point where we're like, I can't I've been able to manage it up until this point, but then it kind of reaches that point where we're like, this is getting a little bit out of control and it's actually impacting my work or my family life or even just engaging with friends and stuff. So in terms of like, let's switch to like hormones. In terms of like specific hormones, have you found any that are really closely linked to anxiety, and what is that interplay with like gut health that you see?
Yeah, so the two biggest ones are going to be estrogen and progesterone, especially in females. And really, you can kind of see it go both ways. You can have too much estrogen and have anxiety and depression, or you can be the opposite, where you have low estrogen and have those same issues too. And that falls in the same category as progesterone. Usually, it's going to be low progesterone. You won't see too much high progesterone causing those issues, but low progesterone will definitely do that. And then estrogen is also does play a role in like bowel motility, so how fast or how slow the bowels actually move. So if we have a drop in that, we can see things like constipation build up, irregular bowel habits, things like conditions like SIBO, for instance, can develop too. So there's definitely a lot of overlap there. But yeah, it can really go either way: high estrogen or low estrogen, and then low progesterone can cause a lot of those similar symptoms.
Can you explain what SIBO is for anyone that doesn't know?
Yeah, SIBO stands for small intestinal bacterial overgrowth. So when we look at the gut, there's between 100 to 300 trillion bacteria in the large intestine, depending on the person. You want that to stay in the large intestine. You don't want it to be in the small intestine. The reason why is the small intestine is a very sterile and clean environment. Because that's where your nutrients should actually be absorbed. So what can happen is those bacteria can actually grow from the large intestine back into the small intestine where they shouldn't be. And then when we eat certain foods or if we come in contact with certain things, they can start to ferment and rot. They can produce a lot of different digestive issues like constipation or diarrhea, bloating, lots of gas. So essentially, to break it down in simple terms, it's where bacteria shouldn't be.
Yeah. And what causes that kind of backflow? Is that just like an overflow of bacteria in the large intestine that kind of needs to find a place to call home, so it goes back the other way to the small intestine, or what causes that?
Yeah, there's a large variety of things. There could be like vagus nerve dysfunction, so to where the speed and motility is not working correctly. You could have things like antibiotic use that can lead to that. Even food poisoning can actually slow things down. Lack of fiber, low stomach acid, low gallbladder function, poor pancreas function. I mean, there's just a variety of different things that can really lead to that.
I feel like you're kind of open Pandora's box when you start to like look into these things. And I guess for some people like that can be really overwhelming, like searching for the root cause. It seems to like kick up, well, actually there's like issues here and here and here. Do you find that in your patients sometimes they're like, oh, it just seems like a never ending pit?
Yeah, and I tell people that all the time. Like, you're kind of like an onion. We're gonna start peeling back layers. We'll probably find more stuff as we go here, and that's a lot of the patients we see too. They're not simple patients. Like they've had issues for 5, 10, 15, 20 years. So there's a lot of underlying other issues too that present as you start working through things. So yeah, there's a lot of overlap in symptoms and really conditions when it comes to it. So no
Yeah.
one's very straightforward anymore. It seems like.
No, and I guess like when you've lived 10, 15, 20 plus years of dealing with like chronic symptoms, there is going to be so many different layers that have to be peeled back because we learn of maybe dysfunctional ways to manage those symptoms or things that kind of have the opposite effect that we desire when it comes to actually treating these types of things. And so we have to kind of peel all of those back as well in the process too. So I can imagine that is definitely like peeling back an onion. I just want to circle back again to estrogen. And I know that this is something confuses me all the time. There's different types of estrogen. Can you explain different types of estrogen for us?
Yeah, so there's three different classes: E1, E2, and E3. So E1 is going to be essentially when you're in menopause. So you won't see that during like childbearing years. E2 is during childbearing years. Oh, and then E3 is when you're pregnant. So each hormone is responsible, or each subcategory of estrogen is responsible for something different. Up until 40, 50, sometimes early 60s, depending on the female, before they go through menopause, again, that's going to be more that E2 dominant stage. If we are pregnant, we'll see E3 take over, which is good because you want that during pregnancy. And then E1 will start to raise again when you're in menopause. Each one does something differently to the course of your life, and we need each one to work efficiently in order to become pregnant, go through menopause the right way, and to maintain a pregnancy.
Yeah.
Uh, Yeah.
Thank you for explaining that. I always look at them, I'm like, estradiol, estrogen, like it confuses me when I'm trying to figure out what's what, but that makes total sense. You broke it down really beautifully. Would you be able to also just shed a little bit more light on outside of neurotransmitters? I know that there's a link to the vagus nerve and the health of the vagus nerve that comes from gut health, but what is it about the gut microbiome and how it impacts that kind of communication flow and just overall health and well-being, as well as our expression of mental health?
Yeah, the gut microbiome is what we know now is connected to everything, right? I mean, lung health, heart health, I mean, you name it, it's connected to it. We now know the majority of our immune system is actually in the gut too, about 70 to 80% of it. So from an immune standpoint, if we see a drop in the good and bad bacteria, we can have more things like colds, flus, COVID, viruses, what we're exposed to. We know now that some of our other hormones are made there too. So like thyroid hormone, for instance, about 30% that's actually made in the gut. Heart health wise, we know that if there is a drop in good bacteria, we can see other things go up like cardiovascular risk, so heart disease and stroke. I mean, the list is kind of endless when you look at it. It's crazy the amount of research that's coming out every year with the gut microbiome and pretty much any health condition or any organ function in the
Yeah.
body. The list is kind of endless when it comes to that.
It's kind of like it's kind of mind-boggling. I feel like maybe 10, 12 years ago when I learnt about, like, I looked into GAPS, so gut and psychologies, and like that was my starting point for my mental health journey, was to like reassess really and take an honest look at like how I was nourishing my body and what I was eating and the things that I was doing that was impacting my gut health. And I saw immense change in my mental health. But back then it was still like, oh, we don't know that much about this. And I feel like since then we've really kind of put the accelerator on to research around this. How do you feel like the kind of ripple effect of that has happened? Do you feel like most people understand the importance of gut health now, or is it still something that's kind of on the bleeding edge of people's minds?
Definitely think people have more of an understanding of it. And part of it is because it's not that it's thrown in your face, but everywhere you go, you see probiotics. It's added to water. It's added to more food. So you see that advertisement everywhere for probiotics and gut health. So there's definitely more of an awareness around it, which is good because it does have such an impact on the entire body.
Hmm.
Yeah, I think at this point, if you haven't heard about the gut microbiome or gut health, you're kind of living underneath a rock because everybody knows something about it.
Yeah, speaking of probiotics, do you sometimes feel like maybe what has become more of a buzz, like to have probiotics, might do more harm than good?
Absolutely. Yeah. War is not always better when it comes to probiotics, and a lot of people
Yeah.
think that. And then too, if you have conditions, say like SIBO, for instance, it's not always good to throw more bacteria in there because that could make your condition worse. So
Mm.
it's always good to kind of figure out what's going on first before you just randomly start taking probiotics. There's a lot of different strains of probiotics too. So some are going to be better for certain conditions, like Candida, for instance. You want something like a Saccharomyces boulardii. But yeah, it really comes down to figuring out like what your body actually needs. And I always tell patients too, like you got to start really low and slow. Because if you throw too much in there too quickly, you're going to get gassy, you're going to get bloated, you're going to get constipated, you're not going to be happy. So that's always my warning to people. Don't just take something randomly without knowing what's going on inside your system.
Yeah, I think that's a great piece of advice to take with you, because it's really easy to kind of fall prey to the marketing of like, if you take this probiotic, you're going to make your gut healthy and happy. And you start taking it, it kind of has the opposite effect, and it like demotivates you to continue doing anything down that track.
Yeah,
I
you don't
think
think
that, sorry,
go ahead.
you go.
Also, the people come in like, oh, I tried probiotics, they don't work. And I'm like, yes, they do. You're probably taking the wrong one or too much of it.
Yeah,
Yeah,
absolutely. And I've done that before as well. All the wrong type, like when you have a bacterial overgrowth in a certain way, and then you start kind of like throwing more fuel into that fire, and you're like, wow, this is the opposite of what I anticipated would happen. But it's interesting. Yesterday, I was watching a reel on how sourdough has this, I think it's Lactobacillus reuteri. I'm probably butchering that.
it's
But
okay.
and how it moves from your gut into your breast milk when you're breastfeeding your baby, and how that protects you from breast cancer. And I find this all so fascinating, just how synergistic our natural flow of bacteria and our microbiome impacts all areas of our health. But yeah, that's just a little side note. I wanted to chat. I think something that I find extremely concerning and very important for most people when it comes to mental health and well-being is chronic inflammation and how systemic inflammation can originate from gut health issues, hormonal imbalances, and how that impacts our mental health. How do you see that kind of show up in your clinical work, but also how do you start to combat chronic inflammation?
Yeah, so from a gut standpoint, one of the biggest sources is going to be, well, there's that's a whole, but from one of the biggest things you're going to see is going to be more like a leaky gut, for instance.
Mm.
That's a common word a lot of people know too. So that's going to be the small intestine kind of ripping open, and then things like large food particles or bad bacteria or even parasites, they can get into the bloodstream. Once they're in the bloodstream, your immune system recognizes them as something that's foreign, and then it starts to create inflammation against that. So that's a huge source of inflammation there. So a lot of that comes down to, again, kind of figuring out what's going on. There are a lot of the foods that we eat contribute to leaky gut. So things like processed foods and seed oils, sometimes gluten and conventionally raised dairy. I mean, there's a large variety of foods. Alcohol, for instance, another one that can actually lead to that leaky gut and then start creating that inflammation. So there's things you can do, obviously, to help combat that. There's certain herbs that are very good for healing the gut. Obviously, you want to remove those foods to begin with, so the ones that are super inflammatory. Start eating more real whole foods, and then you can focus on things that are going to be more anti-inflammatory, like turmeric and ginger, and increasing omega 3s. Those are all good places to start, but a lot of it does come down to the stuff that we're actually putting into our mouth on a daily basis. That's going to create a large amount of inflammation to begin with.
Yeah, absolutely. For things like leaky gut, is that an autoimmune condition or does that cause an autoimmune condition?
It causes out, yeah, yeah.
Yeah, yeah. And so autoimmune conditions, I feel like, are really common due to chronic inflammation, due to gut health issues, hormonal imbalances. Like, what are some of the most common autoimmune conditions that you see coming through your door?
Thyroid issues by far. I mean, that's like number one. See so much of that, especially in females. That's the number one thing that we see.
Yeah.
Lupus would be up there too. So we do see a lot of lupus. Uh, but yeah, I mean, lo and behold, but by far it's going to be thyroid issues.
Okay, I'm good. I have a question about lupus because it's something that I thought was like an old-timey issue, like when I was younger. So, can you explain what lupus is and how that occurs and what it manifests as? And then I want to come back to the thyroid stuff.
Yeah, so that is an autoimmune condition. And maybe we should kind of define autoimmune. I'm sure a lot of your listeners
Yeah.
know. That's essentially the easiest way to describe it is like when your immune system starts attacking your own body. And it doesn't just do that for any reason. There's your body's smart; it doesn't just start attacking itself. There's some kind of driver or trigger there, and we know in all autoimmune conditions, there's kind of three things. There's genetics, so you're genetically prone to autoimmune diseases. There's going to be some kind of trigger, so that could be something like a mold toxicity or high levels of stress, or even like food poisoning could be a trigger for things like that. And then the third thing is going to be some kind of leaky gut. So kind of going back to that. With lupus, your body's going to start attacking soft tissue, and then the manifestation, which you're going to see primarily in a lot of people, is going to be skin issues, especially like around the face. You can see a red rash showing up there. But going back to it again, the whole place where it's starting is going to be back into that gut.
Mm.
It's not in the. It is a more common condition in the past, but something that's kind of still around, and we do see a lot of.
Yeah, it sounds like it would be really common. I think why it kind of sounds like an interesting one to me is like Harry Potter. It kind of sounds like a Harry Potter thing. Like Professor Lupus was part of Harry Potter's books, so lupus sounds like something like that to me. And thyroid issues. That seems to be increasingly common. What does that show up as? If someone isn't sure or is starting to just kind of like become more aware of their own symptoms, what does a thyroid issue show up like?
Yeah, so you're gonna see things like fatigue, weight gain, hair loss is very common, low energy in general. So a lot of people like sluggish get out of bed in the morning or kind of slow to get started. Those are a lot of the common symptoms that you're going to notice. Hair can get a little more like brittle and dry, and nails can get a little more dry and brittle as well. So those are the most common things you would see. And then that's be more from like the hypothyroid standpoint. And then you have the opposite where it's hyperthyroid, where you're gonna have weight loss, you're gonna be hot all the time. You can still get some hair issues. So there's two components to it, and that's where getting testing kind of helps out to figure out which one you're gonna be. Hypo is definitely a lot more common. You're gonna see that one a lot more. And we see that a lot more in female patients as well. We do get males every once in a while, but definitely the female population is a lot more prevalent.
Yeah, I feel like we get all the good things as females.
Guys too, yeah, absolutely.
So, for kind of like moving forward, what emerging research or diagnostic tools do you see most promise in kind of helping us pinpoint or even get to the root cause even more efficiently or effectively than we do currently now?
Yeah, I'm a big fan of like gut mapping or GI mapping. I love that test. We run that on pretty much every one of our patients that comes in the office. The reason why is even if you don't have a gut issue, you have a gut issue. If you don't realize you have one, you probably have one. Just because of the world we live in nowadays, the food we're eating, the toxins we're exposed to, everybody has some kind of microbiome. So we run that test a lot to kind of figure out where things are at. We do a lot of what's called organic acid testing too, which is a great test to look at your body as a whole, figure out if you're breaking down like carbs, proteins, fats. I'm looking at neurotransmitter production. We're looking at detoxification, antioxidant status, nutrient status in general. So we like that test a lot. Standard blood work's great. That's a good starting place, but that only tells us so much too. So we usually do a little bit deeper dive. And then from a hormone standpoint, one of the tests we run in our office is called the Dutch test. That gives you a complete picture of all your hormones and all the subcategories of hormones. Those are kind of the big three runner tests that are in our office, and then we do a bunch of other varieties of tests, but those are the ones that kind of cover 70-80% of people that walk into our office.
Yeah, so that was GI mapping, the organic acids test, and the Dutch test were kind of like the main three ones. If anyone listening is looking to ask their healthcare professional what they would like, then I think they're a great starting point. You brought up a couple of times like environmental toxins and that impact on our gut health and hormones. What are some of the main environmental toxins that you see kind of like wreak havoc in these areas?
Yeah, plastics are probably number one. Plastics are a known endocrine disruptor, so it means they mess with our hormones. They're going to usually drive up estrogen, so they can lead to estrogen dominance in the body, which can cause all kinds of issues. Number two would be like non-stick cookware. So what they spray, your typical cooking pans with, that's another big endocrine disruptor. Can create a large amount of inflammation. Beauty care products are another huge one. Here in America, nobody regulates beauty care products. There's no really regulating governing body like you would have in Australia or Europe or something like that. So there's a ton of toxins in those beauty care products. And then probably the other big one would be like scents and perfumes. Another big thing, again, known endocrine disruptor that can really throw off those hormones.
Yep. It's kind of like the Wild West out there for your gut, isn't it?
It really is. It really is.
And navigating life, like these are things that I've been like aware of for quite some times, but isn't even like going outside of the house to have food or whatever it is, like you're exposed to, especially walking down like aisles in the shopping center, like you smell like all of these highly chemical smells coming your way, and you're like, I shouldn't be here. It's like you just instinctively know this isn't good for me to be exposed to this, but it's kind of impossible to avoid all of those things all of the time. And so I think there's like a fine line of trying to live your life in a way that's going to be most beneficial for your gut and hormones, but also not shelter yourself so much that you're never exposed to these things. Do you find that as well? Like having all this knowledge would really make it difficult to live.
Yeah, you can just live in a bubble and be fine, and there's no issues at all, right?
Yeah.
But that's where like we're going to be exposed no matter what. Like you're going to get exposed. And that's where one thing we always encourage our patients in the office too is, okay, you're going to be exposed, but let's work on, your liver detoxification being your main detox organ. Let's make sure like that's optimized. So when you are exposed to something, your body's at least going to flush it out of the system. So some tools like castor oil packs are great. Infrared saunas are great. Make sure you're drinking plenty of water. Even certain foods can help out with detoxification. So there's plenty of tools out there that you can do so you can offset some of those things.
Yeah, absolutely. Liver detox. That's an interesting one. Is there like whole body detoxification, or do you think focusing on like liver detox is? Because I know for microplastics and stuff, it's really difficult to kind of detox those from your system. Is there one more effective way that you look at for microplastics and plastics in general?
Yeah, so what they're finding out for the last couple of years, there wasn't much research with microplastics, any way to get those out of the system. They are finding out now that the stronger your microbiome, so the more good bacteria you have, you can actually start to degrade and break those guys down. So especially eating more like fermented foods, we are finding out now that you can actually break some of those things down. So there is some hope because we are all exposed to microplastics, but now we are finding out there is ways to get rid of them, which is good.
Absolutely. And in terms of fermenting foods and stuff, I think I saw in your Instagram stories the other day, you were making an interesting looking, I think it was, I can't remember actually what it was, but do you use fermented foods a lot in your own day-to-day life?
Yeah, absolutely. I was making tapache, which is a
That's it.
yeah, fermented pineapple skin. So it's basically kind of like a kombucha, essentially, is what it kind of comes out to be.
Yeah.
But yes, so sauerkraut, kimchi, yogurt, we kind of do a little bit of everything. Aim for at least like 2 to 3 servings per day if I can. And I try to get my probiotics through food versus taking probiotics if I can. And that's what I
Yep.
prefer patients to do as well. Probiotics can get really expensive when it comes to supplemental form too. You can buy a bag of sauerkraut for $3, $4, $5 and it'll last you a while.
Yeah. And making them yourself as well is like even cheaper again as well. And it's fun to kind of go down that rabbit hole of like creating your own food that you know is going to nourish your body in the right way. So I'm going to look up tapache after this so that I can also make that, because it looked, yeah, I was like, pineapple skins, that's an interesting thing to ferment, but I'm open to all of it. So thank you so much for your time today. I really appreciate you sharing your knowledge. Is there anywhere that people can come and find you, your work? I found your Instagram to be a really great resource. So how can people find you and connect with you?
Yeah, my Instagram is at Dr. Marcus Cirelli, so you can find me on there. My website is drmarcuscirelli.com. So we do offer free consultations for people. We do have some online programs too for people who either can't afford to work with us or are out of the country. So there's a lot of options there too. Yeah, doing more of these podcasts, which is always great. So try to make more awareness around gut health as best we can.
Well, I appreciate you spreading awareness and appreciate your time. And I'll pop all the links to contact Dr. Marcus Cirelli in the show notes as well. But thank you so much for your time today.
Thanks for having me. I appreciate it.
Yay, we are all done. Let me just hit stop recording. Amazing.